So when we're talking about stools or poo coming out, you would think the way that you're looking at this, that they're all going to be formed poos that are just in the bowel and just sort of like the bus queue just needs to move along. And that's what we're getting out. But that's not actually what happens in the bowel. So we will have little bits of poo, we'll have big bits of poo, depending on the individual, obviously. But then we will have poo that can be stuck in different areas because the bowel has got lots of folds and there's a few U-bends and curves all around. So it's not just about poo pieces coming out form stools. Sometimes we're soaking away to stuff that's been there for quite a long time. So it's impossible to say how long poo has stayed there. In some terrible cases in America where people aren't being looked after very well in care homes, they have this thing called a megacolon where the bowel can just expand and expand really, really big. And if you Google megacolons, you'll see some pictures of this. In fact, I need to do a piece on that, don't I think? But the bowel can get really, really big, and that can have been stuck there for a long time. With some elderly patients, you can have something called fecal vomiting, where they actually gather so much poo in their bowel that eventually it comes back up this way and they will actually vomit feces out. So that's been in there a long time, and they're not vomiting out stools as we would think of it, as sort of like sausage-like poo coming out. They're vomiting feces. So it can take lots of different forms, if that makes sense, in the bowel. So it can be hard, it can be soft, it can be stuck, it can be rabbit droppings, it can be quite paste-like or clay-like. So when we do a colonic, I would say we get the easy stuff out first, which will be probably formed poo that we're able to just move through, sort of wash that through down that river and get it out. And then we're soaking into the other things that we're getting out. So it's not just like getting formed poo out. There's lots of other stuff in there. So I hope that makes sense. That's not the same for everybody, of course, but that's sort of how it works when you're doing a colonic. We're getting out the formed poo and the gas, and then the more difficult stuff comes away as we soak in, and that starts to dissolve and come away as well. Hope that helps.